Hi people, I'm Gia Nikita and welcome to my channel. Today I'll be finishing my presentation on Introduction to Primary Healthcare, and this is part 3. If you haven't watched parts 1 and 2, you can go back to my channel and watch them before you move on. It should be really interesting. So, what is disease surveillance? This is the ongoing systemic collection, analysis, and interpretation of health data essential to the planning, implementation, and evaluation of public health practice. It's closely integrated with the timely dissemination of these data to those who need to know. Describe 3 classes of diseases surveyed in Jamaica. Well, we have classes 1, 2, and 3. Class 1, we report on suspicion within 24 hours by a notification form. Class 2, we report it weekly by line listing. Class 3, we do the numbers only and we report this monthly. Write notes on Class 1 diseases. Class 1 diseases are vaccine-preventable diseases, as well as disease syndromes, for example, fever and rash, or acute flaccid paralysis. We know that fever and rash can occur from any illness or disease, and so can acute flaccid paralysis. So instead of giving your diagnosis of malaria or dengue, you would you would just record the disease syndromes. We also notify the government within 24 hours about maternal death or cases of rheumatic fever or diseases under the international health regulations. List the factors affecting healthcare delivery. We have 6 factors: clinical factors, patient or client factors, health facility factors, medical or technical factors, and health team factors, as well as politics. We know how politics can influence anything in Jamaica land we love. What are the clinical factors? These are the knowledge, the skills, professionalism, approach, confidentiality, and the level of confidence or awareness of limitations, as well as proper documentation. I'll give you an example of proper documentation. Let's say you're taking an asthma history and you ask the patient, when was your last asthma attack? And the patient is like, I don't know. So your natural inclination is to not write anything because they said they don't know. But suppose that patient goes to court and says that, oh, they have asthma attacks every week, but they weren't treated adequately. And you have to go to court about that. You need to, and when you look in your documentation, you didn't write that the patient didn't remember their last asthma attack. You're gonna be in some deep-ish because you won't necessarily remember that patient because you see so many patients each day. So even the negatives, even the thing you can write, patient does not recall last asthma attack versus not writing it at all. And confidentiality. It's important that it's the patient who chooses what others know about them. So, for example, this is something that I think happens very frequently in health centers. I'm not sure whether or not this is a fact, but man comes in with a STI and he has a steady partner and a side chick. He won't want the steady partner to know that he has a side chick, but he wants the steady partner to be treated, so he gives you the contact information and it's up to you to treat the steady partner. And the steady partner comes in and says, so if I'm being treated for this illness, that means he has it, and that means he got it from someone else. And they're gonna ask you whether or not that's the truth, and your response should naturally just be, you have to ask them yourself. Anyways, moving along, what are the patient/client factors? These include demographics, number of patients being served, economic factors, education levels, and the prevalent conditions. What are the facility factors? The location or accessibility, the physical environment, the organization, the opening hours, triaging, referral systems, equipment and supplies, and of course, the cost. So what are the medical or technical factors? These include the range of common diseases, the time of presentation of care, the patient's education, preventative care, biopsychosocial management, and the medical legal issues. I could go on and on about the medical legal issues, but let's not go there. What are the health team factors? There's a common term called burnout, and this is one of the things that can happen when we don't have an adequate number of health professionals in each category. Teamwork is also very important because we don't want the doctors fighting in front of the patients. Keep it classy, guys. And professionalism, always very important. That's it. Thanks for watching. I hope you learned something.